Assalamu alaikum. My name is MINAHIL TAQUIR and I'm from E2 Evening. My registration number is 2021 DVME 013. So today the topic of my clinic case presentation is congenital hydrocephalus in a stillborn Haflinger foal. Before we get into the history of what the case is, let's first understand and dissect what really congenital hydrocephalus is. Let's completely delve into this topic. Congenital hydrocephalus is basically an inborn abnormality where the CSF, means cerebrospinal fluid, accumulates or dilates the brain ventricles. The CSF can be external, internal, communicating, and non communicating. It totally depends on the location of the fluid in the brain and accumulation of it as well. Um, the different types of hydrocephalus, internal and external. Internal is where the CSF accumulates inside the brain ventricles, and external is when the CSF accumulates outside the brain ventricles. It has been seen and noticed in multiple species, including cat, dogs, ruminants, and many horse breeds, including standard breed horse, miniature horse, quarter horse, and many more. As you see the case history of this very case, let's see what it was about. A 14-year multiparous Haflinger mare, apparently full term, which also means that the breeding and the ovulation date was also unknown, was presented with a complaint of dystocia. Mir had foals before this, and the last foaling was a normal delivery. So that's why the mare was taken to the veterinarian because of the chief complaint of dystocia. Upon doing the clinical examination, we noticed that the mare had been in stage 2 parturition for almost 6 hours. Beside that, the mare had an history of tachycardia and a small amount of dried blood on the right nostril as well. A small or mild amount of hemorrhagic discharge from the vulva was also noticed, due to which a transabdominal ultrasonography was performed during the left jugular vein catheterization, and due to which the fetus was pronounced dead because of the lack of heartbeat. After that, the induction for anesthesia was performed. A 12 mg of intravenous ketamine and 200 mg of propofol was given, and the tail was wrapped and washed with a non-residue soap. Besides that, an endotracheal tube was also placed, and the mare was on serofluorine gas with 100% oxygen, along with lidocaine endobutamine as a concentrate infusion. After being placed in the Trendelenburg position, the mare was in dorsal recumbency with the hind legs elevated via host. Mare blood pressure was also increased, which indicated that the anesthetic plane has become light. So, a bolus of 30 mg of intravenous butyrophenol was also given over 10 minutes. Besides that, the fetus was transectally palpated and was in longitudinal presentation, dorsosacral position with extended forelimbs in the vaginal vault. The foal's head was also extended but positioned just cranial to the pelvic brim, and irregularly shaped cranium was palpated. A cesarean section surgery was offered, but it was declined, due to which the treatment that was preferred to done was a partial phlebotomy. You can also see in the given pictures in the slides the location of the phlebotomy first and second cut. First cut was made transversely through the enlarged cranium, and the second cut was made between first C1 and C2 vertebra. Besides, after the cranial cuts were made, the resultant fragments were also removed, and the chains were placed on the forelimb with a loop above the fetlock and half hitch below fetlocks joint, and the foal was delivered with manual traction. Mare's non-brevet uterine horn intercepted during delivery and was promptly replaced. The fetal membranes also remained tightly adhered to the endometrium, and the mare was recovered from anesthesia, and the tetanus toxoid vaccine was also given. The outcome was that the primary differential diagnosis was an internal congenital hydrocephalus. The mare was routinely treated for retained fetal membranes with a combination of antibiotics, anti-inflammatory agents, ecbolics, and uterine lavage. Uterine lavage was performed twice daily with 5 to 10 liters of lactated Ringer solution, and intramuscular oxygen was also given every 2 hours until fetal membranes were expelled. Antibiotic that were given were intravenous potassium penicillin, 22,000 IU per kg every 6 hours, and intravenous gentamicin 6.6 mg per kg once daily, and an anti-inflammatory flunixin was also given, meglumine, which was 1.1 mg per kg every 12 hours. The mare shed fetal membranes 3 days after dystocia and was discharged from the hospital without any further complication. And the owners elected not to breed the mare during the subsequent season. You would also see the brain matters from the foal cranium. Thank you so much.